I am Jeannette Morrill, and I'm a pulmonary hypertension patient. I first started this journey back in 1976. That was the official diagnosis. About 2.5 years prior to that, I noticed that I was becoming short of breath. I was a phys ed teacher, so that was really out of the ordinary. After another year had passed, I was working out with my basketball team. I was coaching, and I fainted after a lap. Once I had that initial passing out spell, I couldn't climb 2 or 3 stairs without having to sit down or I was going to faint. It wasn't normal for me to not be able to do anything, to become so fatigued at doing nothing. And the funny part about that was an orthopedic surgeon was the one who finally sent me to a cardiologist. Back in 1976, the cardiologist, I was lucky, knew enough to take an echocardiogram, which back in those days, it was a Polaroid camera that they took pictures with. So he suspected after seeing those what it was, but he wouldn't tell me for sure. And I was lucky again that he knew to do a right heart cath. And then that's when, May 5th, 1976, I got the official diagnosis that I had pulmonary hypertension. And I just laughed because I didn't know what it was or what it meant. And then in my follow-up visit with my parents, with me, this cardiologist said to me, you have 6 months to 2 years to live. And he told my parents to take me home and put my affairs in order. The next 20 years was very difficult, trying to adjust at 23 years old that I had only possibly 6 months. And it was devastating, obviously. I did get through it with support. But then the cardiologist who had kind of given up on me left the practice, and a young cardiologist took over and he took my case. And he had said to me, I won't give up and I will work with you as hard as I can for as long as you want to. And he called people all over the world trying to figure out if there was anything else that he might be able to do for me. There was nothing. There really wasn't. He was doing everything possible. And then he went to a conference in 1980, and he found out that Procardia was just being approved or going through the process of approval for use as a heart medication. And one of the things that he learned was that it reduces pressure in some patients. And at that point, I really literally was on my deathbed. I couldn't walk. I was bedridden pretty much. And he came back. I was in the hospital. He came back and he said, are you willing to try this? And of course, I absolutely said yes. And it's unbelievable. Within 2 days, I was up and walking the length of the hallway in the hospital. So he obviously saved my life. I was able to go back to work for 15 years. And then in 1997, I got pneumonia, and then I got it a second time, and Procardia seemed to stop working. And that's when I went to Columbia Presbyterian to see Dr. Barst, because Flolan had just become FDA approved. She immediately put me on that and saved my life, really, again, for a second time. She told me I had to get done working at that point, so I retired for a second time. I pretty much have been called the history book of the disease by my now Dr. Worth. I've been on all the drugs that came along, Tracleer, and then liver enzymes made me stop that. Revatio came along, I was on that. I still am on that, as a matter of fact. And then we added the third pathway, Opsumit, most recent. And so now I'm on Remodulin and Opsumit and Revatio. And I still have Procardia because they said if I reacted to it that sharply, then they wanted to keep me on that as well. I really have not been able to get into any clinical trials because early on, there really wasn't any for me to be involved in. And as soon as I got on Flolan, I haven't been able to find one that I could get into because I'm already on IV therapy. The thing that I find very impressive is the progression. When I was first diagnosed, I never met another person for 20 years or spoke to anybody. And I lived in a small town of 100 people in rural Maine. So I never, ever saw anybody or talked to anybody. And loneliness and isolation and just wondering, how did I get this disease, 1 out of 2 million people at the time? Now, I've been coming to conferences since 2002, and I was given the Outstanding PH Award, and I cried when it was given to me because I would never have seen 1,500 people in a room talking about pH and collaborating as much as I saw. And it just raises your spirits and gives you the confidence that I'm gonna see the cure. I'm gonna live to see the cure for this disease. And every time I come to conferences, same thing happens. You know, you get inspired. I've traveled all over the country as a peer mentor, telling my story and trying to raise awareness. I have a golf tournament every year and trying to raise funds. I try to encourage other patients to tell their story because they have to pitch in and get their faces out there so that awareness can be raised. And this disease will become not that rare disease that it was back then. People will know what it is instead of trying to tell you that it's blood pressure and they have it too. I can tell you, I've had many situations where I've seen people who have just become newly diagnosed and they're scared, they're afraid. The first thing I say to them is, I've survived for 42 years, and you can see either tears come or they give me a big hug. And I said to a lot of people, I find out what they're on for meds, and if they're not on the IV ones yet, I say to them, there's so much hope for you because you haven't had to start the big guns yet. Those are in the background. They're there for you if you need them. And I know that I'm making a difference. And because I'm making a difference, it helps me so much to continue on and be brave enough to tell my story. And that's been a hard thing to do. The first few months, year even, I was so lost and not being able to find my way. So now I've come to that point many years ago that I stopped feeling guilty, because guilty is a wasted emotion. You're wasting energy that you might not have. So I've really learned to stop feeling guilty. The next thing that I think is so important is that there is hope, and there will always be hope. I get up every day and I just make myself, I don't care if it's one of those days where I want to stay in bed, I make myself get up and set one goal. Even if it's making my bed, that has to happen every day, no matter how I'm feeling. And I do have ups and downs a lot of the days, but I just try to take every single day, make it important. I'm Jeannette Morrill. I'm aware that I'm rare.